immediately we saw behavioral health. They were already high utilizers of telemedicine, really coming out of the pandemic. Healthcare, mental health care needs were um, certainly recognized during the pandemic, and coming out of that, people continue to do that. So the vast majority of our behavioral health services are telemedicine right now. And so we've continued to see that success with eVisit. Moving into our medical side, family medicine has seemingly taken it on pretty well. We have one of our clinics who's really taken to family medicine, the providers that are there. That said, we do have one provider that's all she does. She's dedicated to telemedicine. And so that's all she does. So it makes those numbers look good. We struggle with our other two primary medical sites with pediatrics and with women's health. Women's health is obviously a little bit more complicated. There's a lot of room, I believe, in the pediatric side to be able to do things. And in speaking with their medical director, a lot of it is those providers, they're just used to be able to put their hands on a child. And so we've had a lot of conversations around, like, how do you do that physical exam without having to touch the patient? What sort of visits do you have to have? So working through that has been a challenge that the medical director is very willing to dive in with. And we've had some really good conversations around that.
Helpful to understand. Lydia, any thoughts from you?
Yeah, I have a lot of thoughts. And, I did say this a moment ago. There's so much of a cultural understanding about technology. And I think we inherently as an organization fight against this. Ironically, we're a super young organization. So when you look at the number of employees we have under the age of 40, it's like 85 to 90%. So I find that ironic. But we have a real push against using technology. But I think it's really about helping our staff understand, again, this equity issue that I keep referencing. And I think that we have these pockets of people. And so when you look at change management, there's that curve, those early adapters. We definitely have those early adapters. We have those people probably in each service line. Peds has that person, women's health has that person, but there's that one or two that they love it. They get all their patients to follow up, they get them doing it, but then we have those laggers. And I think that's where we get stuck a lot, of just helping people understand that this is a real benefit to our patients. And so it's in our culture that we're now really kind of pulling through the mud. And I do think that we are really starting to see that benefit of, you know what, instead of having my medical assistant call the patient for their lab results, I could do a telehealth. And then we're not going back and forth with about 6 telephone encounters back and forth. Yeah. I could just see them and we could have this conversation. And now as an executive, it's also financially beneficial. You can run it through insurance. The patient's way more satisfied. The time decreases down. So now we're talking about burnout prevention. And so I think a lot of it for me is learning how to kind of approach it from a different standpoint. But I think I've had to realize that this is a culture change. It's not just telling people you have to do it. And I'll give just a quick personal example that probably everyone here has heard, but kind of in the midst of the pandemic, I needed to see an allergist, and I was on a wait list prior to the pandemic hit. They said, well, you can see your allergist by telehealth. And I was like, well, what, to the pediatrician's point, what are they going to do in an allergy appointment on telehealth? And I was like, that's okay. And they're like, then you're going to go to the back of the line. I'd already waited for that appointment 6 months, to which then I was like, well, never mind, I guess I'll do telehealth. And they did everything. And then I went in later and did my blood tests. And so I think these are the kind of things that we're having to talk through. Like, we have to help people see the benefit. And I think that's where we are right now, of just kind of those switches.
I think what I just heard you say, and don't let me put words in your mouth, so keep me honest here, but what I think I just heard you say was, you engaged with the provider who thought about the care delivery model in some smaller chunks, and then as a result said, this is the chunk that's really appropriate for virtual. I can accelerate here, but I don't want to, you know, undercut or dismantle this piece of my care delivery process. So it almost sounds like you're working with folks that are rethinking, kind of rebuilding a care delivery model using virtual. Is that right?
Correct. And I honestly think the ones that are fully bought in, they saw it and then they build on it. And I think it's just like, even for me as now the patient that saw it, I prefer telehealth now for any appointment I have, if I can do it, and will ask for that. But I had to buy in as a patient. I think the same is true for the doctor or the PA. So you have to really change that mindset. The same is true for the MA or the call center. It's just changing that lens and realizing when the patient has to take off work, that's a drive. When the you know, they have to get their kid out of school, or they have to pick their kid up, you know, everything takes more time, and we all know healthcare, everything's long. So I think there's just so much more that can be done, and when you really start looking at it through an equity lens, telehealth really does level the playing field.